Welcome everyone to our panel. The title of the panel is Race, Space, and Power in Richmond, Virginia. My name is Adam Ewing. I'm an associate professor of African American Studies at VCU, and I'm going to be moderating the panel today. This panel is part of the ongoing History and Health Racial Equity program, which is being offered by the Office of Health Equity. The program includes virtual events and online modules in which we explore how VCU's complex history affects our health system as patients today. It is premised on the idea that we need to understand our history in order to forge a more just and impactful future. Health inequities and the disparate outcomes they produce are deeply rooted in US medicine. We hope the History and Health program will inspire all of us to think of new ways VCU and VCU Health can help promote the health of everyone in Richmond and the Commonwealth, improve social determinants of health, and develop exciting opportunities to engage with and learn from the communities that entrust us with their care. We would like to thank our partners at the Humanities Research Center for their support in producing today's event. The way that this is going to work, the panel is going to last for about 45 minutes. After that, we are offering an optional facilitated discussion for question and answers until 1:30 p.m. We will be recording up until the discussion time, and the video will be available on the History and Health website. If you have questions, you can begin to populate the Q&A with them now. Finally, before leaving Zoom, please make sure you complete the very brief electronic survey that will be provided to you. Okay, so let me introduce our panelists in alphabetical order. First, we have Derek A. Chapman. Dr. Chapman is the interim director of the VCU Center on Society and Health, which seeks to improve population health and advance health equity through social determinants of health research, authentic community engagement, and actionable communications. Dr. Chapman has been a faculty member in the Division of Epidemiology in the VCU Department of Family Medicine and Population Health since 2004. Next, we have Torrey J Edmonds. Ms. Edmonds is a lifelong resident of Richmond's East End, a graduate of Richmond Public Schools and VCU, and is currently a community outreach coordinator at VCU Health's Communities for Youth. A longtime community activist, she uses this experience to help translate research in a way that is relevant to the everyday person. She is dedicated to helping change the negative narrative often associated with Richmond's low-income children and families. Ms. Edmonds has been published in several journals and has received a number of distinctions for her work. Among them, in 1998, she was given the Mayor's Award from the City of Richmond for Outstanding Community Leadership in the 7th District. In 2002, she was named a City of Richmond Distinguished Citizen. Third, we have Julian Hader. Dr. Hader is a historian and associate professor of leadership studies at the University of Richmond. His research focuses on modern US history, African American history, and the American Civil Rights Movement. He is the author of The Dream is Lost, Voting Rights and the Politics of Race in Richmond, Virginia. His work has been published in the Journal of Policy History, The Washington Post, New American History, and various national publications. He also regularly contributes to national and local media outlets. And finally, we have Mariah Williams. Born and raised in Harlem, New York, Ms. Williams is an urban planner, housing advocate, adjunct professor, and researcher dedicated to highlighting the experiences of Black people and spaces in cities. Her work on Black joy, Black women, and community has been featured in Next City, Third Wave Urbanism, and For Harriet. Most recently, Ms. Williams' work on gentrification and displacement in Richmond's historically Black neighborhoods was published in Richmond's Racial Equity Essays. She formerly served as the Director of Policy and Research at Housing Opportunities Made Equal of Virginia. Ms. Williams received her BA in Sociology from the University of Richmond and her Master's of Urban and Regional Planning from Virginia Commonwealth University. Welcome to all four of you. So, okay, let's get started with the panel. So when you examine the composition of Richmond's neighborhoods today, what becomes very clear is that they are racially segregated and hugely unequal. I'm gonna put up a image from the Cooper Center at UVA showing the racial composition of Richmond and the greater Richmond area according to the 2010 census. And I should say that if you look at any US city, you notice a similar pattern of stark segregation. Give you a moment to take a look at this. So Today, we want to have a conversation about the health implications created by this reality. We also want to talk about how this reality came to be, how Richmond's human geography was shaped, and we want to discuss solutions, how we can break patterns that reproduce racial inequalities. How can we improve health outcomes in our city? So the first question is for Derek Chapman. Derek, you're the interim director of the Center on Society and Health, which is an academic research center that studies the health implications of social factors, such as education, income, neighborhood and community environmental conditions, and public policy. Can you talk about the ways in which social factors affect health? And can you talk about some of the health disparities that are created by our segregated and unequal neighborhoods?
Sure, happy to. Let me see if I can get a screen share going for you. A couple of visuals to help with that. All right, hopefully you're seeing a social determinants of health slide. So social determinants of health, if just have a little level setting definition, are simply the conditions in the communities where people are born, live, learn, work, play, and age. So, a question that's often asked is, why should health systems and doctors care about social determinants? Well, unaddressed social determinants of health inhibit their ability to accomplish the historical goals of medicine: relief of pain, prevention of disability, and the postponement of death. So we always mention that healthcare is important when you're sick, but your health is determined by many factors experienced outside the healthcare setting throughout your life course and all of the settings that social determinants of health cover. So the simple example I give folks to understand this is, if you're having a heart attack right now, access to quality healthcare is absolutely the most important critical thing. But reducing your risk for heart disease occurs outside the clinic. So often folks think of illness as solely unhealthy personal choices related to diet and exercise leading to a disease. And then you have to go to get medical treatment for that disease or condition. However, those choices around diet, exercise, and personal choices in general are often limited by the neighborhoods that we live in. And the choices we make depend on the choices available to us. So as another example of this, consider obesity, which is linked to a whole series of poor health outcomes and premature mortality. So again, as I mentioned, personal individual eating habits and exercise are very important and directly related to obesity. However, one has to have access to healthy foods to eat healthy foods. And by access, there's multiple access levels. And this means you have to have access to information about what constitutes a healthy diet. So, education is one of the factors on here. We talk about social determinants of health. So, communities that have weak tax bases cannot support high quality schools. Then you also must have physical access to healthy food where you live. So stores that sell unhealthy food, including fast food chains and many convenience stores, frequently outnumber supermarkets that sell fresh produce or restaurants with nutritious food. And in some neighborhoods, they're the only source of food that's readily accessible. And then also in terms of physical access, you need transportation of some kind to get to that store. So if it's too far away to walk, then it's not accessible. Or if someone doesn't have a car, or there's not a bus route or other transportation available. And then the third kind of access to healthy foods is financial access. So unhealthy food options are actually quite affordable. So you can get a lot of calories for a little bit of money. The healthier food, fresh fruit options, et cetera, are certainly more expensive and can be limiting to some folks also. A second thing to consider in our obesity example is, in terms of, related to that financial access, in some neighborhoods, good jobs may be scarce in neighborhoods that have struggling economies. So getting access to those finances to obtain healthy food options may be limited by employment options in your community. And then back to the example, the exercise side of things, you can say if people exercise more, they have less obesity in communities, but exercise in some communities might be limited by both the physical and the built environment. There could be safety concerns in high crime areas that make it not as easy to get out and be out and about, walking and jogging. Working multiple jobs limits the time you have for exercise. Something as simple as a lack of sidewalks or lack of parks are going to make it more difficult to have physical activity. And then finally, like a lack of disposable income for things like gym memberships. And then on the eating side of things, overeating may be a coping mechanism for a number of issues, including untreated depression, stress related to bills or exposure to racism. And of course, no medical treatment can occur without access to primary care doctors and good hospitals, access to which may also be limited in some communities. So the impact of these social determinants of health on health outcomes is immense. My center has computed a small area life expectancy in about 25 or so cities all across the country and found large gaps by neighborhood, including this 20-year gap in life expectancy at birth in Richmond City between Gilpin Court, which is public housing development that has over 90% Black residents, and Westover Hills, which is a predominantly white high-income area. So 63 versus 83-year life expectancy gap. And in a related project in the metropolitan Washington, D.C. area that included Northern Virginia, we found an expected strong association between life expectancy and social determinants of health, especially with community level education and economic factors. But residential segregation has limited access to health opportunities so extensively in this country that in that project, half of the variation in life expectancy at the neighborhood level was explained by race and ethnicity. In other words, if you just knew the number of Black and brown persons living in a neighborhood, that was the single biggest predictor of having transportation issues and lower income and limited educational and employment opportunities, et cetera. So as we'll be discussing today, the neighborhood disadvantages that exist for many of people of color did not arise by chance. They're the products of policies, both past and present. So I'll pause there. I think there's going to be other speakers have a lot more to say on this issue, but hopefully that provided a little bit of a background for things.
Great, thank you, Derek. So what we want to do in this panel discussion is to talk about the current layout, the current geography, and health outcomes across Richmond, but also look a little bit at the history of the city and how these inequalities were created. So my next question is for Julian Hader. Julian, how were these inequalities created and maintained in Richmond? What does our history teach us about the way our city looks today?
Yeah, I think one of the things we have to remember is, and think very intensely about, is the intentionality of racist public policies in the 20th century, right? This is like an assumption in the United States that, structural racism would just go away the further we got up from our, tortured racial history. But when you recognize how intentional the public policies were in the 20th century, you recognize that things done purposefully not only have contemporary implications, but are probably going to need to be undone with a kind of equal intentionality. And people saw this coming, by the way. I think 25 years before the American Civil War, a French aristocrat and scholar named Alexis de Tocqueville wrote a book called Democracy in America. For all of its glaring limitations and its splendid commentary on American life, his ideas about race in some ways stood the test of time. He argued, that as he saw it, the South had two choices. It could either manumit its slaves and treat them with some degree of civility and dignity, or it could perpetuate their serfdom for as long as possible. And in effect, that's what Jim Crow segregation is, by the way. It's a perpetuation of Black serfdom that characterizes most of the 20th century. The idea, right, people like John Hope Franklin and Black scholars of the 1960s recognized that the idea of Black freedom always intensified white prejudices. And in time, this serfdom and this intensification of prejudice comes to define the nature of the American city, especially cities like Richmond, which was the capital of the Confederacy. And I think the first thing we have to think about, I can zoom out a little bit, is that cities are a series of human decisions and ideas matter when making those decisions. Or as one of my colleagues at UVA said in a panel I was just on, is that there are no blank slates when it comes to the American city. And so we have to think about the nature in which history shapes what cities became. You know, there are things that begin to influence Black health in Richmond that on its face have little to do with health, or seemingly little to do with health at all, right? You know, a lot of times people romanticize about segregation. Like one of the, you know, underlying ideas of the lost cause that African Americans were unprepared for freedom. Well, if you look at the communities after the Civil War, nothing could be further from the truth. But there's another story with these communities in cities like Richmond, where on the one hand, communities turn inward, African Americans build what many people call the Harlem of the South. But these neighborhoods over the course of this 20th century, we can't romanticize about how successful they were without talking about how they were systematically disinvested in, right? Taxable revenues being funneled to others' communities at the expense of these communities, right? All this starts well before redlining, I might add. We like to zero in on redlining. Richmond and Baltimore were two of the first cities in the United States to enact racial zoning. So before redlining, we begin to see that race is shaping the nature of space in the city of Richmond. So Richmond would have been segregated long before redlining. And what we begin to see is by the 1930s, an intensification of decades-long movement to ensure, for various reasons that I won't get into right now, but I'd definitely be happy to talk about in the Q&A, neighborhoods become increasingly segregated, right? And what we're most familiar with is how the process of assessing property values and risk with recourse to race comes to define redlining, right? This process where the government encouraged bankers, local officials to, in effect, create residential security maps that were a way for people to assess risk. Blue and green, of course, being safe investments, red and yellow being risky or places where you didn't want to invest at all. All African-American neighborhoods in Richmond, regardless of their socioeconomic standing, were designated red, which means local lenders essentially, with the help of the federal government, on the one hand, build a culture of homeownership in white and suburban communities and systematically divest in African-American communities from the 1930s moving forward. But it doesn't stop there, right? People continue to bring their biases to bear on city beautiful plans and urban renewal initiatives. What begins, right, it starts really to gain momentum in Richmond with slum clearance. So what we begin to see is areas like Church Hill, which had been built haphazardly in the late 19th, the early 20th centuries. If you look at Church Hill before the 1940s, it looked like a Brazilian favela, right? These were dangerous places. And these dangerous places weren't specific to Richmond, and they weren't specific to African-American communities. They were specific to the way that people built communities in the late 19th and the early 20th century. And the problem then begins to pick up steam with redlining, where these undervalued communities begin to struggle because people are displaced by things like slum clearance. And the problem is twofold. People are not only not getting fair property value when their houses are torn down, they're disallowed from moving into other particular neighborhoods. It's the same thing. Like I was like, even the way I was raised, I was like the richest kid on a poor block, right? Most African Americans, as a matter of course, because of restrictive covenants and the historical legacy of racist public policies that had to do with urban development, struggle to meet these challenges, especially in cities like Richmond. And one of the things that happens is the construction of housing projects. And these places obviously have become, for various reasons, namely disinvestment, areas of profound disappointment. So by the mid-20th century, Black communities in Richmond were really struggling, right? I'll give you some data here, right? 66,000 Black housing units or dwellings failed to meet minimum health requirements and sanitation requirements in Richmond, right? The city was referred to as having a rotting core, in large part because money wasn't being funneled into these areas. Right? Very few people recognize this. Most of the city's waste refuge plants, or waste refuse in general, would go into places like Jackson Ward. There weren't proper sewage systems. Running water wasn't channeled out. People were dying from diseases in mid-20th century Richmond that had all but been eradicated from the white world. There were 7,500 homes that were either overcrowded or where African Americans were forced to double down. 14,000 homes with private toilets only. Without indoor private toilets, 13,000 without private baths, 2,600 without running water, right? 20,486 with cold water access only, right? This is an epidemiological disaster in the making. Ed Grimsley of the Richmond Times-Dispatch said on March 17th of 1959, right, that overcrowding in African-American enclaves had given rise to poor sanitation, rampant disease, and a general lack of adequate medical care. So Black Richmond had one of the highest mortality rates of any city in the United States by the mid-20th century, namely in the 1950s. And there remained deep skepticism, by the way, in African-American communities, not merely of urban planners, but medical professionals who serve these communities. Much of this was holdover from the kind of pseudoscientific interaction that eugenicists and some of medical professionals played in African-American communities in the late 19th and early 20th centuries. A little had changed, by the way, by the late 20th century. In fact, when African-Americans grab political control of the city of Richmond by the late 20th century, it was a hollow prize. All of the epidemiological and urban implications had begun to rear their proverbial ugly head. I'll give you some more data. 1960, 46% of African-Americans in Richmond had less than 8 years of education. In 1975, nearly 25% of Black families were still beneath the poverty line. Richmond was more segregated by race and class in 1980 than in 1940. And this carries on well into the twilight of the 20th century and even into the present. There remains in Richmond, areas in Richmond where you can walk across the street and life expectancy goes down by 15 years. Shockingly predictable outcomes because of the intentionality, the structural racism that I just blew through very quickly. But I can go into a lot more detail if you want me to. And in Richmond, like many American cities, you can tell how long and how people will live simply based on their zip code, right?
Yeah, just really quickly, that idea of intentionality is really important.
Yep.
Because I think there's a way in which you can imagine this story as being something that's just sort of too complicated to understand, or a series of like individual choices compounding upon each other.
Right.
But what's striking, of course, is that if you actually look at the record, this is a very conscious and repeated effort, right, to invest in white communities, disinvest in Black communities.
One of the trends of the 20th century, by the way, with public policy is over-documentation. You don't have to go far. And by the way, people would have spoken specifically about race in these documents because they had no fear, right, of being punished. Like, so if you go to urban planners and people who are responsible for redlining, they are specifically talking about not only what they're doing, but why they're doing it to Black people. So ignorance is no excuse when it comes to this history, because there's more than enough documentation that demonstrates the intentionality of these public policies in the 20th century. Right?
Yeah. Okay, so let's turn over to Mariah Williams. Mariah, can you talk about some of the ways that these inequalities persist today? What are current issues that exacerbate racial inequalities?
Sure. Thanks for that question. And, I think the short answer is kind of what you and Julian ended on, and that Julian had not nearly enough time to lay out, is that, they are predicated on policy and legislation that were created intentionally, right? And specifically, I'll talk a lot about the intersection of kind of health and housing, since that's kind of my space, but to ensure that African Americans and people of color were shut out economically, and from housing opportunities that were deemed to be the fabric of the American dream. And so, the residential security maps or redlining maps that were created, not just for the city of Richmond, but for cities across the country by the HOLC, are unfortunately the blueprint for the current racial inequity we see today. So the communities that were previously redlined are also the communities that experience the highest rates of poverty. They're also the communities with the lowest median household incomes. They're also the communities with the highest rates of food insecurity. They're also the communities where schools are financially under-resourced. And not surprisingly, they're also the communities that are predominantly African American. So you start to see the pattern. And I think, what is even more insidious about the legacy of these policies is that even in the 21st century, we can specifically see how they impact housing and housing opportunity. And as we know, as Derek stated, this is a huge factor in determining things like life expectancy and health outcomes. Neighborhood and built environment and social and community context are social determinants of health for a reason. So in particular, I want to highlight kind of 3 kind of housing specific issues that show how these racial inequities have been exacerbated, really to say, hey, this is not a thing of the past, right? This is a thing that is happening in 2021. And the first is around eviction. So for folks that are unaware, Virginia was put under a pretty big spotlight in 2016 when research from the Matthew Desmond and the Princeton Eviction Labs revealed that of the top 10 largest cities with the highest eviction rates, 5 of those 10 were located in our Commonwealth. Richmond was number 2 with an annual eviction rate of 11.4% between 2000 and 2016. So for over a decade, this was the trend. And I think what's even more startling about that trend is when you start to peel back the layers of the demographics of the renter householders that are being most impacted by evictions. We see that they are Black. We see that they are female heads of households, and we see that they typically are households that have children in them. And so during my time at Home of Virginia, as the research and policy director, we did some preliminary research that showed in the city of Richmond, the rate at which an unlawful detainer is filed, which an unlawful detainer is kind of the first step in a landlord pursuing an eviction. Those were higher in Block groups that had higher number of Black renter householders. So essentially in neighborhoods where there were more African Americans that were renting, those Block groups tended to have higher eviction rates compared to the other parts of the city. The second trend that I'll speak to is racial disparities, I think, when it comes to home ownership, and that's both as it relates to access, but also maintaining it. And so I won't assume that folks are aware when we think of home ownership, the Black-white home ownership gap is larger in this country today than it was in the 1960s when the Fair Housing Act or the Civil Rights Act of 1968 was passed. In Virginia, that Black-white home ownership gap is almost 30%, right? So 30 percentage points between the Black home ownership rate and the white home ownership rate. On top of that, not only do we have that gap, but research also shows that Black homeowners, we tend to purchase homes 7 to 10 years later than our white counterparts due to a whole host of reasons, namely one of them being access to capital, down payment to be able to purchase home. But we also know very structural barriers to home ownership as well. And I think related to this, right, is, we think about, well, now we can kind of think back to the impacts of the 2008 foreclosure crisis and how it hit homeowners, but particularly Black homeowners who were disproportionately targeted for subprime loans. So the impact of this was obviously devastating because the equity that these homeowners had in their homes was lost due to foreclosure. And many Black homeowners have not been able to recover. So I share this, related to home ownership to say, not only were, people of color shut out of home ownership opportunities 50 plus years ago, we also see current day inequities further exacerbated by the 50-year head start that our white counterparts have had, right? And then lastly, I know that, in my work, and this is something that is, I think, top of mind, particularly in Richmond, as we're seeing how our neighborhoods are transforming, is the process of gentrification and the subsequent displacement that's happening, not just in Richmond, but we're also seeing it in legacy Black cities and communities across the country. And I think, the same communities that have suffered the historical disinvestment are the same communities that are attracting new investment today. And a lot of times that is from folks who don't and have not lived in the community. And I think, as a result of this, one thing that happens, property taxes are increased. And unfortunately, if there are not tools in place to help residents remain in housing in an affordable way, it leads to them being physically displaced from the communities that they have been able to call home. And often what happens is, particularly when we see low and moderate income renters being displaced from once affordable communities, is that they relocate to high poverty, low opportunity areas. And I think, we'll have a conversation about the health implications of that. So I'm going to stop there because I know we'll have more time for Q&A and discussion.
Yeah, of course. Mariah, can I ask you a quick follow-up? Because when you're talking about gentrification, I mean, I think we maybe need to talk about VCU in this story. Like, what role does VCU play in some of those processes that we're talking about?
Right. I mean, I think, I think it's important to, when you define what gentrification is, right? Like it's the process of kind of bringing resources, investment into a community. The root of gentrification, the gentry class kind of moved in and started doing what folks do. And I think when I think of kind of the VCU's footprint and expansion over, particularly the last 10 years, it is important to think about, that expansion is not just happening in communities that are that are kind of race neutral, agnostic, right? They are places, they are communities with histories, and so it's important. It's always been important, but I think it's particularly important for an institution with a footprint as large as VCU to be thinking about kind of not only where they are going, but how those resources are impacting the communities and the folks who have always lived there.
Great. Okay, well, let me on that note, turn things to our final panelist, Torrey Edmonds. Torrey, you're a community outreach coordinator with VCU Health. What work does VCU Health do to address social determinants of health in Richmond's East End and elsewhere in the city? Another couple of questions. How do Black communities perceive VCU and VCU Health? And does VCU's historical relationship with the Black community hinder its efforts to provide care to the Black community today?
Okay, so for the first question, I'm a community outreach coordinator for VCU's Healthy Communities for Youth. And we do a lot of work in the East End and other parts of the city, really trying to understand the risk and protective factors. What are those factors that exist in our communities, primarily Black communities, that put our young people at a higher risk of some issues such as violence, teen pregnancy, drug use, and some other antisocial behavior? And we spend a lot of time talking with the residents in those communities to truly get a sense of what's happening. A lot of great information have been shared about how we got here, about the policies and practices that exist to continue this big divide between our Black communities and our white communities. And one of the main things that I think I would love to share, we talked a lot about the history, and I'm talking about how it shows up today. We know that 95% of all those low-paying entry-level positions in the city of Richmond is filled by Black people. When you think about VCU as a health system, and as a person who spent my fair share time in VCU as a patient, a lot of times what I observe is the people that look like me are either the ones that's bringing my dinner or cleaning my rooms. But if I had to go and get a test, say an ultrasound or a CAT scan or something, they look differently. And I've always wondered, how do these young people find out about those positions? Why is it that everyone that looks like me is either cleaning my room or bringing my lunch, or they could be registering me, but they're really at those low-level entry jobs. And so what is it that we're saying? What is it that VCU as an institution that said we're inclusive, hiring Blacks for low income, for low entry-level jobs, and not really opening those other opportunities don't truly make you inclusive. But when you look at the impact that VCU have had in our Black communities, older people especially, they think about the time where people would go missing and they were saying people would snatch bodies at night, and then you had the big well thing. But folk feels as if VCU has a great reputation of all the research and some of the top-notch treatment, but you're only entitled to that treatment if you're white. So what they feel like, VCU will either heal you or kill you. As a Black patient, it's not warm and fuzzy. And so you got to think about, why is that? Why do Blacks feel that way? We're going to talk a little bit about kind of my experience in living in the East End, which, you know, they look a lot at zip code. So if you're in 23223, they've already taught students coming in a certain narrative about the patients that come out of that zip code. And so rather than really get to know the patient themselves, they kind of assume they know that patient by the data and narrative that they have had from that zip code, and they proceed to offer treatment that way. And then it doesn't allow for that doctor who's treating the patient and the patient themselves to kind of build that trusting connectiveness that is needed to happen. And so VCU has done a lot of great work and tried to do a lot of great work in the community. And it's not all bad, but I think that we have to be real conscious of the narrative that we use to describe these neighborhoods and understand how some of the data points that we look at, that we take in consideration, came to be, and look at it from a holistic perspective. I think that we talked about the history. We talked about, you know, people working 2 jobs, and, you know, they're working several jobs. They're still below the poverty level. They don't have good health care. And so the way you receive treatment really will depend on the quality of your health care and your ability to pay. And I'll stop right there.
Okay, so we have a lot of balls up in the air and a lot of things that I have more questions about. And I'm seeing that there are a bunch of questions already populating the Q&A. So I'll encourage everyone again that if you have questions, please send them in and I will relay them to the panel. At this point, I'm gonna start to share some of those questions. I might interject with some of my own if I get curious. And I'm just gonna throw the questions out to the group, and you all can fight over who wants to answer them. So the first question is actually speaking to the East End from Kirsten Olson. Can you speak to what you know about the history of the 7th District of East Richmond, Varina, and a bit of Charles City? It is predominantly Black, and there is Black wealth out here, generational land ownership, new suburbs and suburbs being built with $200,000 and $300,000 price tags on homes and big boats when you go out on one of the river landings. Why is there only 3 elementary schools, 1 middle school, and 1 high school out here?
So when they talk about the East End, and then they talk about Charles City and Varina, we're talking about totally 2 different communities. Varina is in the eastern end of Henrico County, and Charles City is further out. So that's a little different demographically than if you're talking about the 7th district in the city of Richmond. And so when they talk about the 3 elementary, 1 middle and 1 high, are we talking about the city of Richmond? Are we talking about Henrico County or Charles City? And so those kind of 3 totally different communities. And you're right, in Varina, you will have higher income level of Blacks that live out there in the suburban area. In Charles City tends to be generational land ownership where families tend to pass their land from one member to another. But in the city of Richmond, that's totally different. So they need to be kind of clear about exactly where we're talking. 7 district, you're right, you have 1 high school, which feeds 4 of their public housing communities along with homeowners. The same go for the middle school. And we do have, actually 5 elementary schools in the East End of the city of Richmond.
I mean, let's just call it what it is. You know, if we're talking about the 7th district on the East End, why there aren't more options, because the city of Richmond has been reluctant to do anything meaningful about people who live in public housing for decades, structurally and, you know, in terms of quality of life. And the General Assembly also plays a part in this, but I think it's abundantly clear that there are forgotten communities in the East End that don't have the type of public service deliverables that their West End counterparts or even people on the North Side have. And it's by design, again, and it's kind of shockingly predictable. I think we all know why there aren't a number, why there's disproportionately high number of people in one high school than in other parts of the city. And it has to do, I think, with the demographic makeup of people on the East End and the city's reluctance to treat those folks like human beings.
And I'm going to share a screen that maybe will help, just a map that maybe can put some context if folks can see what we're talking about. This is a, this is a map just showing the large housing developments in the 6 large housing developments in Richmond. This one is, the base of this is poverty rate, but just to show you the clustering of segregated and racially segregated and concentrated poverty in the Richmond. And so we're talking about East End, they're referring to this region over here.